Hello everyone, my name is Paskarina. I'm from Faculty of Social and Political Science, Universitas Pajajaran. Today I will present my article, which titled Lead by Data, Citizen Engagement in the Time of Crisis, How Big Data Construct Collective Behavior in Combating COVID-19. COVID-19 is a global pandemic, but it also makes us aware that we need to participate actively by changing our behavior to slow the ongoing spread of the global pandemic. From many countries, we learn that mode of governing the spreading of this virus is led by data-based citizen awareness and timely government response. This article focuses on production of data that later on diffuse into social media. Currently, artificial intelligence and big data provide prediction through machine learning algorithms, which we could analyze the data and provide visualization for how the disease is growing and spreading. While the significant role of social media is acknowledged during infectious disease outbreaks, such as in this previous research, but the explanation of how exactly social media affect the public response and behavior has yet not fully explored. Therefore, this article seeks to advance our understanding of data-driven participatory in the case of combating COVID-19, to investigate the process of knowledge creation, transfer, and transform from big data to construct collective behavior. This article uses literature study as methodology, operationalized with systematic review method. Kittenchan and Charters propose to use the acronym PICO, Population, Intervention, Comparison, and Outcomes, to identify keywords and formulate search string from research questions. Population refers to specific literature containing the discussion of COVID-19 and big data. This article identified keywords are coronavirus or COVID-19 and big data. Data is collected through article journal that published in website of scopus.com in the year of 2020. Intervention refers to method of governance applied in response to COVID-19 by coding data into two themes, namely usage of big data and knowledge produced from big data. Next, those themes is interpreted to explore how this process constructs collective behavior from citizens to participate in combating COVID-19 as an outcome. The results shows that there are three types of usage of big data. First is to identify subject. This includes health condition, travel history, and tracking contact. Second is to identify emotion toward disease, which include fear and anger, and also risk perception. And the third one is mathematical modeling, which include simulation from data to predict reproduction number of the virus, design of control measure, and set priority decision. And now the result from knowledge of big data, we found that there are four types of knowledge produced from big data. First one is about the disease itself, the symptom and how COVID-19 is diffused or transmitted to other people. Second is the subject. This is the individual with high risk, who is the potentially infected people. The third one is treatment. This includes disease prevention and disease curation, about the protocol to control people movement and behavior, and also identifying transmission process. And the last one is about the response to outbreak. This include informed infectious disease-related risks, and then research and model-based prediction and policies to prevent transmission, which include self-isolation and social distancing. From the result, we find that for some countries that had previous experience with infectious disease outbreaks, its government has established institutions or at least protocols to deal with the disease spreading. In addition, past pandemic also provide a database that can be used as research material and produce knowledge that can be used when faced with a similar situation. From this result, we found three findings to be discussed. The first one is process of knowledge creation. Knowledge produced by big data includes identification of subject, namely people who are potentially exposed to COVID-19. The data used is sourced from travel history, health condition, other diseases that may be affected by the subject, as well as contact history, at least within the previous 14 days. Identification of other diseases that are infected by the subject from knowledge about the vulnerability of the subject health condition, which in turn determine what the subject will be treated with. After the subject is identified, big data produce knowledge about how the subject will be organized based on categorization. There are three categories created, namely positive subject, subject under surveillance, and patient under supervision. The method of handling will be determined by the categorization. The legitimacy of the method of handling the subject is strengthened by the regime of truth through the simultaneous dissemination of information about how other countries deal with the spread of virus, best practice that can be followed, the distribution of relevant research results, and mathematical modeling as evidence of knowledge, claim about who the subject is, why they are governed in a certain way, and who has the authority to govern it. Then we proceed to discussion finding number 2. How is the process of knowledge transfer? The mechanism of knowledge shows that the big data that is spread online and through the result of previous research is used to first inform about the working of COVID-19, method of prevention and treatment, as well as the latest situation development related to handling COVID-19 by various countries. Social media and various personal communication platforms such as WhatsApp and short message service are widely used for this purpose. Second is to visualize the enemy. A number of sites such as worldometers.info /coronavirus or other website in national and local level present data visualization with graphic and maps of the spreading that make it easy for readers to understand the danger of the epidemic spreading. This presentation on that data uploaded by this site are also used by academics to make simulation through mathematical modeling, both to predict the development of the situation as well as to analyze the effectiveness of various possible interventions. Third, analyze big data becomes a source of information for individual, community, and government to determine the action to be taken. Visualize big data construct the reality about COVID-19, generates knowledge about that reality, and directs the action of individuals, communities, and government in responding to that reality. But how do the production and dissemination of knowledge then shape collective behavior in response to COVID-19? This brings us to the third finding of discussion, the construction of collective behavior. Previous studies of risk prevention behavior shows that behavior can change when individuals assess the risk they face cannot be controlled. In the case of the spreading of COVID-19, the mapping of literature review shows that big data is also a disciplinary instrument used by individual, communities, and government to reshape behavior. This disciplinary mechanism can be seen from the recommendation produced by various research results and practical experience of other countries, which are amplified through the dissemination of information on social media. Social distancing, self-isolation, quarantine, hand washing regularly, the use of masks is information that is conveyed repeatedly to discipline individuals' bodies. In a number of countries, the role of government is more focused on handling victims who have been identified as having the virus, while prevention is carried out independently by practicing social distancing and work from home. Big data, as a disciplinary instrument, is assisted by technology for social surveillance. For example, through a body temperature sensor device, a mobile or a wearable apps that tracks contact automatically by proximity of device, and a quick test tool to identify affected subject. With these big data tools, all compromised individual can be tracked or isolated. Big data can help the government effectively forecast the development of a given pandemic. And to do that, we need to integrate the collection of data in surveillance. Therefore, we end this discussion by conclude that it is necessary to optimize data-driven method by using integrated database to formulate evidence-based policy in an attempt or effort to combat this pandemic. Information from big data analysis need to be well communicated to establish public trust toward government. For this reason, the government needs to routinely convey the latest situation development in handling virus as well as other information needed by the public to maintain their health. Individual and community can help reduce the spreading by disciplining themselves in social distancing, personal hygiene, and participate in self-isolation. And for the last, combining those approaches is needed as the knowledge of the virus is still learned and developed. Thank you very much for your attention and for listening to this presentation. Stay safe.